We have Dr. Gary Donovitz here. He is the founder of BioTE, which is a bioidentical hormone replacement program. And this has been one of my solutions that's really affected my mental health in a positive way while I was going through menopause. Um, I basically fell into a very severe depression during that time. Didn't know what was going on. It lasted a year and a half. And then I started an antidepressant, was doing pretty good for a year and a half, but then I weaned off of it and I fell back into this depression, which is a mistake, really. But this time, not only did I go back on an antidepressant, but I started bioidentical hormones because I realized that back in college, I actually was having it's called premenstrual dysphoric disorder. While during those hormone changes in our menstrual cycle, that you could fall into a bad depression, which is what happened occasionally, but I didn't really make the connection until later. But anyways, I have started BioTE 4 years ago, and since then I have felt better than ever. And I had all of the real very bad symptoms of um, of menopause. Uh, thank you so much, Dr. Donovitz, for BioT. And I wanted to start off uh, by what I hear sometimes from other women about hormone replacement therapy, based on an old study that was done in 2002 by the Women's Health Initiative, showing that synthetic hormone therapy can cause things like cancer or actually increase the chances of that when used during or after menopause. Can you tell me why using bioidentical hormones is different?
Sure. So synthetic hormones are usually from an animal. And the one study that you mentioned, the Women's Health Initiative, both hormones in that study, Premarin and Prempro, both come from the urine of a horse. And that hormone that's in both of those products, women have never made. So you have a synthetic hormone that your body's never seen, and it has many more side effects and many less benefits. Bioidentical hormones are typically plant-based, meaning they come from a plant, usually soy. And what we do is we take the hormone that your ovary made, like estrogen, like progesterone, like testosterone, and we create that same hormone and then put it back into your body, whether it's a cream or whether it's a patch or a pill or a pellet. And at BioTE, we favor pellets because we get better blood levels, more consistent blood levels, but at least your body is seeing the same hormone that it saw for its whole life. And the problem is so many people wait till menopause to start thinking about hormones. As you mentioned, the Women's Health Initiative, the average age in the Women's Health Initiative is 63. It would shock you to know that most women start losing testosterone, which is the hormone they make the most of their whole life, at age 25. So for 40 years, they've been losing a hormone that they needed. Then they started losing estrogen at menopause, and then people didn't replace it for some 10 years later. And of course, they had issues, not just because they started late, but because they used synthetic hormones.
Yes, so that is a big difference. And, you know, when I was going through menopause, I was getting hot flashes and night sweats that made it very hard to sleep. I was getting tired, brain fog, gaining weight. I mean, there were so many different symptoms or conditions that can happen when your hormones are off. And one thing that is actually a quote taken from your book, I actually have it here. It's called Age Healthier, Live Happier. Avoiding over-medication with natural hormone balance. But one of the quotes says, the state of our health is directly related to the state of our hormones. Can you tell us more about what you mean by that?
So many people actually get their problems or their symptoms band-aided by medications, not just hormones, But other things like antidepressants that you mentioned, or fad diets or diet pills or sleeping pills, and we take a pill for everything that has a problem, but we never get to the root problem. And the root cause for a number of the symptoms that women experience, both in that premenstrual dysphoric disorder that you mentioned and others, and depression and menopause, is actually an imbalance in your hormones. So what we believe at BioTE, and what I talk about in the book Age Healthier, Live Happier, is how do we optimize, not just replace. And I think that's probably something we ought to talk about today, because lots of people have hormone replacement therapy, whatever that is, just taking hormones, but they don't individualize that therapy. They don't optimize their own hormones. But when your hormones are optimized, you sleep better. You have less depression, less anxiety, less weight gain, and that brain fog that you talk about, that poor memory, focus, and concentration, is much better when your hormones are optimized. And so therein lies the problem. The root problem is the hormone imbalance, not the fact that you were Prozac deficient or deficient in Ambien or deficient in diet pills. We're not deficient in diet pills. We have a situation where our hormones are not balanced, and because we're low on some hormones, and we could even be low on some and high on others, then our bodies react in such a way that we may gain weight, we may have brain fog, we may not sleep well, and all of that can lead to depression, anxiety, and all the things you talked about.
Well, one thing that I felt, while I was going through this change was that all of these hormones that were protecting my body and also causing it to work efficiently were just starting to diminish. And I felt the physical and the mental effects of that. But also, after menopause, things like heart disease can skyrocket in incidence because of the loss of estrogen. So there are other medical conditions that also can be tied to hormones. Is that correct?
That's correct. And in fact, breast cancer the same. We just published a study in April showing a 40% reduction in breast cancer, optimizing a woman's hormones with testosterone, with or without estrogen. So estrogen is not the bad guy, as many people have heard. Testosterone is not the bad guy. And in fact, together, with or without the estrogen, but together even, they were able to lower the incidence of breast cancer. We're able to actually prevent osteoporosis. We're able to reduce your chances for Alzheimer's. And as you mentioned, once we lose estrogen at the menopause, 1 in 3 women are going to die from cardiovascular disease. It is the number one killer for women. So the question is, how can we prevent heart disease? Well, we've got to get there early. And we've got to stop the plaque formation that starts way earlier in life than most people believe. It's not something that starts when you're 50. It started when you were 20 or 10. And so it's a case of getting there early, optimizing your hormones early, and preventing the cardiovascular disease. Once the estrogen starts falling at menopause, we're in a much better position to reduce heart attacks, to reduce stroke, to reduce plaque formation, which is going to make that second half of your life better, because we can make people live a long time, Maury, but the question is, are they going to be in a position where they feel their best, or are they going to have a hip fracture and a heart attack and their brain's going to be gone and demented? Because that's not a great way to age. So how could you age better and stave off some of those diseases that you talked about? And I think that's what BioTE tries to do.
Yes, I actually am ready for my next pellet insertion for BioTE. And the first things that I usually notice is that my sleep gets really poor, toward the end of my of this, pellet therapy, and start to get muscle aches and brain fog. And so, I really definitely feel the effects usually about 4 months or so afterwards.
Right.
But can you tell us, you were talking about the personalization that BioTE has. Can we talk about how BioTE is different from other bioidentical hormone replacement therapies?
Sure. So in the Women's Health Initiative, you saw people had taken Premarin if they didn't need progesterone, or Prem Pro if they did need progesterone, and they had a uterus, but there's no individualization. The individualization is, here's a pill, take this pill and hopefully it'll make you feel better. We actually look at your hormones. We look at your testosterone level. We look at your estrogen level. We look at your thyroid level, and we decide from there what would be appropriate for you. So as an individual, we can optimize the hormones that you need and not just make it a one size fits all approach. If you do that, where it's one size fits all, your side effects will be higher, your benefits will be lower. And the worst part is people won't stay on the therapy. So you see people start this hormone therapy, hormone replacement therapy like Premarin and Prempro. Half of the people stop in the first year. We have 80% or better retention long-term, meaning people stay on pellet therapy as you have because they feel better, because it's easy. Like you mentioned, 4 months. Most women are going to get their pellets about 3 times a year. So it's not something you have to do every day. Most men are going to do it about every 5 months, so twice a year. And that's a lot easier than taking 104 shots if you're a male, or taking a pill every day, or rubbing creams on twice a day that are going to give you very high levels of these hormones and actually, in some cases, make you feel worse, not better.
Well, you actually mentioned some of the things that I've tried previous, which are creams and different patches. And, the first time I was treated, I was for like night sweats, which were really bad. I was given a birth control pill, which is a hormonal based. And I realized that took care of it within a day or two. I was amazed. And so that, kind of led me to investigate more about bioidentical hormones and, how it could be done more naturally. And one thing about BioTE is that it's a small little pellet, right? Like less than the size of a grain of rice that's inserted under your skin.
Right.
And it slowly melts throughout the time period.
Right. So it doesn't so much melt as it dissolves over time. And the nice thing is it's completely gone. So some people confuse pellet implants with implants that they've seen like Norplant, where they're loaded with hormones, but you have to take them out after so many years. You don't take out pellets. They completely dissolve, or melt, as you say, and they're gone. And then you get your next insertion 4 months later. That's a nice thing because you don't have to keep taking things out. The pellets will dissolve, and you're getting the right amount of pellets, because we have different doses of pellets. Even though they're small, like a grain of rice or smaller, we have different doses of testosterone, different doses of estrogen. So you get just what you need, not maybe what somebody else needs. And then the male pellets are different than the female pellets. So we're able to individualize for men as well as women.
Right. One thing that I used to be in the pharmaceutical industry, doctors always want to know about studies and scientific research. Can you bring us up to date on some of the scientific research and studies that have been done on bioidenticals and the benefits to the body?
Sure. So pellet therapy has actually been around for 80 years. A lot of people think it's new, but it's not. It was used back in the late 40s, and it was used for the symptoms of the menopause, particularly in women who'd had a hysterectomy and others. And it has been used now in 5 continents and millions of women. There's been multiple studies on this bioidentical hormones that you talked about. And what we do know is that testosterone is very important. My second book that you haven't mentioned, which was Testosterone Matters More, it's because it does matter more than estrogen. It covers more of the symptoms of the premenopause, more of the symptoms of the menopause than does estrogen. There was a great study 30 years ago that looked at testosterone, it looked at estrogen, it looked at a combination of the two, and then it looked at placebo, just basically a sugar pill. And what they found was testosterone was better for the majority of the symptoms than any of the other hormones. And in fact, placebo and estrogen were the worst. We have looked at patches against pellets and on estrogen, And what we found was there's much more consistent blood levels with pellets than with patches. So that's a nice benefit. We also published, a study about, 6 months ago. And that study looked at 1.2 million pellet procedures, 1.2 million, the largest study ever done with less than 1% complications. Now that's amazing because if you get the dose right and you get the procedure right and you have less than 1% complications, it makes it a great thing for women and for men so that they will stay on the therapy. And there was very few side effects and very few secondary reactions, and all of those reported in that study.
Yes, I feel like it's, I really haven't noticed any side effects with the therapy. Just the importance of knowing exactly where your levels are is so important because, if you have too much or too little of something, again, it's going to can affect you mentally or physically.
Right.
One thing I noticed is that, there's so many chemicals in the body. How does stress and the overactivation of our adrenal glands affect our hormones?
Right. So what happens when you're under stress is the body makes a lot of cortisol, which is a stress hormone. It can adversely affect your immune system, which you don't really want to do right now, particularly with COVID out there and the variants of COVID. So you want to keep your immune system at its best, which is what we do at BioTE, both with our hormone therapy and our vitamin program. We keep your immune system boosted, which is an important thing so that you can avoid COVID and avoid the severe complications from COVID. Now, having said that, when you're under stress, the adrenal gland is producing all these hormones at the detriment of other hormones. Or if you're low on, say, testosterone, the adrenal gland can make testosterone, but if it makes testosterone, it does so at the expense of other hormones it's supposed to be making. You hear about adrenal fatigue, if you will. And so now the adrenal gland is running behind on its production of important hormones, and yet is trying to keep up with the body. So if we optimize the testosterone, the adrenal gland can recover. If we get rid of the stress, we don't overproduce cortisol and adversely affect our immune system. If we get rid of the stress, we don't adversely affect our thyroid, which can also be affected by the stress. So if thyroid is affected, that's going to affect your immune system. That's going to affect your brain function. That's going to also affect your energy level and how you feel. So we want to keep your thyroid optimized and do something to get rid of the stress. The testosterone optimization program actually lowers your anxiety. In fact, people feel much calmer on that, which is kind of the start to getting off of some of these antidepressants. We get 50% of people off of their antidepressants because we feel like it does rob you of that quality of life that you're looking for. It does rob you of the highs and the lows, so you feel everything blunted, but that's not the best way to go through life. And if we can get you off your antidepressants and have you feel better and have less stress, your body is functioning at an optimal level.
Yeah, the reason I ask that is when I look back at my own history, and a lot of people that come on the podcast also mention this, is that stress, which can also be positive stress. Maybe people are overworking or they're not taking time to exercise, things like that, not sleeping properly. There's so many different kinds of stress, but that can really, trigger a mental, physical response, through hormones, through the adrenal glands. And I found also as I got older that my tolerance for stress really got much lower after I went through menopause, which is something that nobody talks about. Nobody talks about all these effects that happen. So I'm glad, we're talking about it because it also happens with, you're talking about men, right? Men have changes in their testosterone and different levels in their body as they get older.
Right. So that's what happens as men go through andropause, which is very similar to your menopause. They lose hormones. And as they lose hormones, their anxiety levels go up. They don't sleep as well. Their amount of depression goes very high. It was interesting when you mentioned hormones and depression earlier. We actually did a study, it's been a while now, on PTSD in our veterans back when we were in the war in Iran and Iraq and in Afghanistan. And what we found was women who actually went to war who had low estrogen levels, whether it was because they'd had a hysterectomy or they were on birth control or they artificially lowered their hormone levels because of stress, as you talked about, and stress will lower your hormone levels. Just the fact that you're under stress. Those women had almost a 50% incidence of PTSD, post-traumatic stress syndrome. That's bad. And they have very hard time coming home and then functioning back with their families and society. And so we know from that study, as well as others, that your hormone levels can absolutely affect how you feel from depression, PTSD, and anxiety, men and women.
Right. I mean, I always thought, as I learned more about mental health and, triggers and also time periods in people's lives that mental health starts to falter. For instance, in puberty, usually during adolescence, people first start having symptoms of depression or anxiety. We all know about postpartum depression and, of course, menopause. But these are times where hormones are fluctuating, which, again, can really affect our mental health. One thing you mentioned is the Nutraceuticals, which is like vitamin supplements that
Correct.
Can you talk more about that?
Sure. So we use a number of nutraceuticals or vitamins. One of the biggest ones is what's called A, D, and K. It's vitamin A, vitamin D, and vitamin K2. It's very important for heart health. It's very important for bone health. But the vitamin D levels that we achieve because of our product actually boost your immune system. And we have seen a significant decrease in the number of COVID cases and the severity of COVID. We also have one that helps metabolize the hormones that we're giving. So yes, it's nice to get your testosterone level up, men or women. It's nice to get your estrogen levels up. But then where do those hormones go? How does your body take care of those hormones and metabolize them in a safe way? We actually have a product called DIM, and that product will actually help disperse those hormones and get rid of those, eliminate those hormones from your body in a very safe way. We also believe that gut health, or the health of your gastrointestinal tract, very important for your immune system. And we have a probiotic, not just what you'd get in yogurt, but a real probiotic that actually can establish a very good, healthy amount of bacteria, the right bacteria in your GI tract. So we have that. And we also have a B complex vitamin that will increase your energy levels. So many people need energy to start exercising. They need energy to do their jobs, and they felt really fatigued, particularly in this pandemic where they've been locked up in their house. And this is a way, through our pellet therapy, through our nutraceuticals, through our B complex nutraceutical, that we can get an immediate increase in energy levels, which is also really good.
Yeah, I definitely can attest to like a B complex that really not only gives me energy, but also keeps me mentally calm during those times, during those challenging times. So it's kind of an interesting effect that it has. But just to let our listeners know, I mean, the things that are included with BioTE. You're talking about estrogen, testosterone. I take oral progesterone,
Right.
and an Armour thyroid.
Right.
And let's see. Oh, and then I also, take vitamins that can, work with this whole symphony of hormone replacement.
Sure. That's exactly what we do. We optimize the hormones. If you need progesterone, we absolutely believe in oral or pills. Progesterone, we use all bioidentical progesterone so that it works just like the other bioidentical hormones, and it is safe. You don't have to worry about blood clots. You don't have to worry about breast cancer. You don't have to worry about the other problems that synthetic progesterones can cause you. Bioidenticals are very safe. And so the bioidentical progesterone that we use is really the best that you can get, which I'm sure that's what you're on. So that's a really good testament for what we do. The vitamins then support the cells of the body, so they're ready for these hormones. And then the symphony really comes together, as you said, because you have the right vitamins with the right hormones that's right for you. And we have other vitamins that we use in people who have autoimmune problems or people who have joint pains. So it's not just limited to those four. And that way we can take into account what your symptoms are and individualize the therapy for you.
Okay, well, that's interesting because I have psoriasis, which is an autoimmune disease. And, while I was going through my really bad bout of depression, it was flaring up a lot. So I'm glad that there's that kind of personalization that you can give to the patient. Now, I've also read that BioTE and bioidentical hormone replacement therapy can have positive effects on other conditions such as diabetes. Can you tell me what's on the horizon for bioidentical hormone replacement therapy?
We're actually looking at that now. We had known for years that in men, the people, especially how many diabetics there are in the world, 650 million, as your hormones fall, your chances for diabetes go up. As your chances for diabetes go up, or as if you get diabetes, your chances for heart disease go up. So if we could prevent diabetes, it'd be great. What we know now is testosterone is the insulin sensitizer. It is one of the products that's out there that actually lowers your chances for diabetes. No one's ever looked at that actually in women, and we're actually studying that right now because it would be great to know that if in women who got their hormones optimized, we could lower their chances for diabetes just as their male counterparts. So we are looking at that. We are looking at our health assessment questionnaire to see how many of the 20 symptoms that women are likely to get in the pre and post menopause, what percentages get better with hormone optimization where they don't have to take medications and deal with the side effects. And so that's really important. And we're looking at starting hormone therapy earlier so we don't have to deal with the ravage of osteoporosis and hip fractures and the drugs that cause so many side effects to treat osteoporosis. What about preventing osteoporosis? So we have that on the horizon.
Well, that's really exciting. I just think there's so much that can be learned from hormones and how it affects our body and how we can affect that medically in a positive way so that, not only for mental health, but for physical health. But Dr. Donovitz, thank you so much for educating us on
We're doing something along the lines that you're doing with a guy named Christian Daniel, who is, I don't know if you know Christian or not. He's a singer, Emmy Award winning. He's actually in Puerto Rico and he's traveling around in Puerto Rico right now, delivering the same message that you are, that, hey, look at your mental health, look at your hormones and get them back in balance, because he's noticed the same thing that you've seen with musicians and others. I mean, he's going out to the masses going, hey, I know you enjoy my music, but I want to help you also, because it's been a problem for him as well as a number of his friends who've had mental health issues, and how do we spread the word? So we're actually part of a big project in Puerto Rico right now with BioTE doing exactly what you do, getting the message out.
That is wonderful. I really want to keep in touch with you about that information. Okay. And I'm going to look up that musician. Maybe he could talk about that on our podcast.
I'm sure he would.
But is there anything else you would like to say about BioTE, Dr. Donovitz, or about mental health in general?
Well, I think I'd like everybody to know that we've trained now 6,000 practitioners. We're the largest in the world doing what we do. So there is a doctor out there near you. We're in nearly 50 states, Mexico, Puerto Rico. We have almost 200 doctors in Puerto Rico also. So we're able to really get close to you. It's not something you have to travel a long way for. And all of our practitioners are certified. They've been trained in the BioTE method. They know how to optimize your hormones. They know what symptoms to look for, and they can take care of you and do a really good job at making you feel your best no matter what your age. And I really appreciate your time, Mark.
Oh, sure. And thank you so much. I'm going to be getting my BioTE pellets this week. So
Okay, good luck.
thank you again.
Okay, bye-bye now.
Bye-bye. Hi, I'm Mari Fong, producer and host for Check Your Head, Mental Health for Musicians podcast. If you enjoyed this video, please subscribe to our YouTube channel. If you like us, please follow us on social media at Check Your Head Podcast and visit us at checkyourheadpodcast.com, where you'll find over 100 mental health resources that will assist you in your mental health recovery. You rock, and we love you.